Dear participants, dear panelists, welcome to today's virtual webinar, moving on with telemedicine. This is the final webinar in the series of five that are being prepared together by healthcare.si, the Medical Chamber of Slovenia, and Central European Initiative. We are really pleased that we have as our panelists today Mr. Gornik from the Better Company and Mr. Rebec from SRC Infonet, who live digital health. They will share their viewpoint on how the digital science is developing in Slovenian healthcare, which of course cannot happen and should not happen without medical doctors. The introduction will be moderated by Gregor Cuzak, and they will also be joined by Heidi Kosednar from the eHealth Support Center and Mr. Igor Zorko from the Slovenian Digital Coalition and Vice President of the Chamber of Commerce and Industry of Slovenia. The introductory part will be very interesting, so I already invite you now to leave your questions in the chat. And we will do our best to raise them in the debate to the extent possible. May I also thank, on behalf of HealthDay.si, to Dr. Čebašek Travnik, who gave and listened to us, who paid attention to us. Even due to you, we find ourselves here, Dr. Čebašek Travnik, and I would like to invite you to give your introductory address. Good afternoon, and thank you for this pleasant introduction. It's moving to hear you say that. My period of presiding over the Medical Chamber of Slovenia is coming to a close, and I couldn't think of a better conclusion than bringing this series of telemedicine seminars to an end. I tried to be modern and to keep up to date throughout my term of office, also when it comes to the digitalization of our profession, also when it comes to the functioning of our medical chamber, but also when it comes to using digital tools to support our doctors in their duties. This series of webinars has also revealed something else, namely that in such a format of 40 minutes, if it is repeated regularly, we can reach out to a significant number of people who are ready to learn and who are ready to network with people they can then address to. And I'm really pleased to see that we have many participants, many attendees today, and I find it extremely important that this is so. Even though I am completing my term of office, I still hope that I will be able to continue working with you in the future. And now I would like to invite you to listen to these really interesting lectures and panelists. And one further thing, when digitalization projects are implemented, I am really highlighting and advocating that everybody should involve physicians in the early stages, because the final user, the doctor, in his relationship with his patient will be really grateful if you do so. Thank you very much. Thank you, Dr. Čebašek Travnik, for your kind words. Mr. Vasya, Mr. Tomasz, now you are kindly invited to turn on your mics, and I already look forward to hearing what you have to say about digitalization in healthcare, about what has already been introduced and what is the fruit of the Slovenian know-how. And I would also like to know what you think of the future. What are the next steps that need to be taken in order for the doctors and the patient treatment to be more effective? Yes, hello. Tomasz and I agreed that I will actually open this part of the webinar. And if I can start, well, I think that there are indeed many solutions available. But one of the basic things that we need to be aware of is that the small telemedical solutions are actually embedded in a larger context, be it the e-health, the CRPD, server equipment, GDPR, be it what it may. So this system, which includes telemedical services, is extremely broad, and telemedical services are only one segment of daily digital transformation processes. Perhaps we can recall a case And I guess that we all watched this youth film, Karate Kid, which was extremely successful. And the protagonist, Daniel, painted his fence, and he was actually also polishing the car, and he failed to understand how these two activities help him better defend himself. So to put it in plastic terms, when it comes to telemedicine, the situation is similar. It means that this is a composite part of a broader context. In the end, the film ends with the motto, everything is Kung Fu. So we could say on equal terms, everything is digital transformation. If I may give you a practical example, perhaps the solution QMate. I guess you're all familiar with it, with this solution. It's not a classical telemedical solution. But if you look at it from a broader perspective, the QMate brings the patients from and gets them actually from the waiting rooms. If we interlink this with the e-appointment, then it turns into a telemedical service. And if we connect it then further to obtaining healthcare records in a safe manner to smartphones, then we come full circle. And in so doing, we not only obtain a basic telemedical service, but we obtain a foundation for analysis, for improvement, and for a new routine, which needs to find its place in this context. So, something that we always tend to ignore is that most simple telemedical solution will always be embedded in a larger ecosystem. And these ecosystems and solutions need to be had in mind. On the other hand, I would like to highlight that even we, as solution providers, tend to make a mistake because we think that our clients, our providers, our professionals always see the full picture. Well, I could recall a beautiful poem by Slovenian national poet Prešeren, which speaks about a shoemaker who sees or walks down the street and sees a painting which also depicts a shoe, and he sees that this painting has certain deficiencies. The painter then corrects these deficiencies and arrives at an improvement. But when this shoemaker says that something else is wrong with the painting, then of course the painter gets a bit angry. So what I'm trying to say is it's not supposed to make us angry, but all of us who are involved in information solutions or telemedicine solutions, we should listen to the professionals who notify us of deficiencies in our processes. We need people who will tackle the digitalization of processes as fast. We need enthusiastic doctors. It's not for certain that we will always immediately develop the perfect product, but such experts and professionals move the boundaries that we work in. The video consultation, you will recall, is a classical telemedical solution. It seems quite simple when you look at it at the first glance, but at every location, it has brought about many issues, be it in firewall, etc., etc. I don't need to enumerate all the problems it encountered, but perhaps as an interesting feature, I can share with you that approximately 850 video consultations performed in this time with the data that we have available for our available. So out of those 850, 600 of them were conducted by a non-public provider. So if a solution is implemented, it can be good and it can prove beneficial. Why did it fail to gain ground elsewhere? Well, there can be various reasons for that. But the fact remains that any telemedical service will need a certain motor, a certain engine, and somebody who will take care of it. The benefits it can yield can also be broader, not only the direct that can be perceived in the first instance. So I find this extremely interesting. I think that Slovenia is the world champion when it comes to telemedical solutions in pilot or production phases. We are talking about extremely interesting telemedical solutions, for example, for monitoring patients at home. So we have really a range of available such solutions. And 15 years ago, our hospital in Golnik had a very interesting solution for certain treatment at home. We got a pilot project, we also got European funds for it, and this is where it all stopped, where it ended. I see many services allowing for monitoring patients at home, and I really hope that they enter a broader production phase. There are not so many that would be extremely established or well spread, but many are extremely innovative and excellent. I think that we need to be aware of one thing in particular. We need our experts, as Mrs. Chebashek already mentioned. We need those who will help us introduce novelties into our systems. And we are then the ones who need to ensure that the foundation and the framework is stable so that the system can cope with it. And another thing that perhaps deserves mentioning is the following. In the digital transformation process, we cannot promise that there will be less work. I think that there will be an increasing amount of the digital work. New digital know-how will be required. New digital resources will be needed. Still, our message needs to be, if we need to be economical, and I come from the Primorje region who moved to the Gorenska region, which tends to be economical. Let us save funds in conjunction or with the help of the IT systems, not on account of the IT systems. And this will allow us new know-how and new routines. I think that we can help ourselves by seeing the professionals as the arbiters, and we can be the engines moving things forward. And perhaps with this, I can end my presentation. Thank you, Vasya. My name is Tomasz Gornik. What I would like to add to this is, as Vasya put it, there are many solutions already available. We can distinguish between telemedical services, and we can actually categorize them in various groups. The first group is that allows for better patient access, so for example, allowing video consultations with their doctors. Then the second group facilitates the work of the medical doctors, particularly those where the professionals are lacking on all locations where they are needed. So for example, in Slovenia's case, this would be the telestroke example, which makes it possible to use somebody who works from a certain site, and they can assist a person in the field. Just this morning, I called a hospital in England, and they introduced this at their emergency wards. So their intensive care wards actually are partly monitored from a central location, which helps to reduce the number of staff required at the bedside, which of course is in shortage due to the COVID situation. So there are many situations, and if we only speak of telemedicine in terms of it replacing the real in-person visit, well, of course, this can bring a big advantage for the patients, but it won't really change the process itself. It will help us to reach people more easily. So patients will no longer depend on their local doctors, but they will be able to have a video consultation with an expert wherever they may be. But this is just a part of the picture. We see that what's going on now is that this telemedicine can be upgraded with the use of data. So we are not only talking about consultation, but also that the nature of the treatment is changing, which means that the doctor, on the one hand of the connection, will have at his or her availability many data from the patient in a digital form, which means that this treatment can be less periodic, it can be continuous even in certain cases. But of course, this also raises the question of how this can be managed in an appropriate manner. There is an anecdote which I heard just recently from a doctor. He said that if I tell my colleagues that they will get digital data from their patients, from the metering devices that they're wearing, they will all quit on the sixth date or the same date, because it's impossible to monitor all this information. So the concept that is emerging is really close and similar to the air traffic controllers. What we are seeing is that patients will be able to contribute their data in a continuous form, but at the same time, there will be a unit based on informatics and artificial intelligence, of course, that will filter this data and establish which of them are such that reaction is needed immediately and which of those are in normal limits. And I find this comparison quite interesting, because the lack of data is an issue, but on the other hand, also the flood of data poses an issue. So if I revert to Vasya, what he was saying, well, I always get a question of how can the amount of work, the workload be reduced. It's difficult to do that, but we need to ensure that this work yields value added. So I wouldn't really only speak about physicians, but of all healthcare providers. So they need to have such solutions at their disposal that will help them do work that has an added value, rather than just using the data that already exists in the system. One of the starting points was also to compare the situation in Slovenia and in countries abroad. Of course, it's interesting, or actually we need to know which countries we are talking about. If we compare ourselves with Scandinavia, they are moving forward at a really fast pace. What I was struck by in the spring when COVID broke out, the Finns already had an action plan ready for every elderly inhabitant of Helsinki, both from the social and healthcare point of view. So I was really able to see that system, and I found it extremely proactive. It included nutrition, all requisite assistance. So everything was planned for every individual. So, of course, we can agree that we are not there yet, but if the countries are at the same level year, the dynamics is such that would on other terms be used in a period of 5 to 7 years when it comes to the use of modern tools and telemedical services. And to conclude, I would like to say that we need to be aware that digitalization, including telemedicine, have several phases or stages. The first one is to digitalize data themselves, i.e. to introduce systems that will do away with the paperwork. And most of the developed countries have already come to a significantly high digitalization level. Then the next step is to link this data into a certain whole at the level of a city, region, or nation. And here, differences are already more tangible. And in Slovenia, thanks to the fact that our system is relatively homogeneous and also relatively small in size, so we can say that we are compiling this data in a relevantly high quality manner. Then the third stage is to analyze this data to determine the risks for certain diseases, predisposition for certain diseases. Well, this is done in smaller units, not generally, but we are not lagging behind the majority of European countries, with the exception of Scandinavia, perhaps. And then the fourth stage of digitalization is that we include or incorporate the knowledge gained from this data back into the healthcare system. And I have to say that all countries across the world find themselves at the beginning when in this respect. Why? Because other industrial sectors have already gone through this system. May I just mention financial industries or even sports? So they are much more advanced than the healthcare in this respect. And this shows that still many potentials can be tapped in this respect. So learning from data and incorporating knowledge back into the healthcare and treatment processes. So these are the four stages, and I'd say that most of the countries find themselves on stage 1 or stage 2 still. Thank you, both of you, for your thoughts. Well, this discussion was extremely interesting, in fact, and it actually presented a really nice framework for our debate, showing that telemedical services are just a small small mosaic in the digital transformation process. So we will need to make a leap in data processing, but also when data is managed, this will also need to be translated in other fields that need improvement in the future. And now I would like to move or give the floor to Gregor, and actually I would like to invite Heidi Kosednar and Igor Zorko also to unmute their mics and join us. Thank you very much, Mojca. I hope my mic is on. You can hear me well. Good afternoon. I see that actually today's webinar has most attendees, the highest number of attendees in the series of the 5 webinars, and I'm extremely pleased to see that. Well, I would actually like to give the floor immediately to Heidi. Heidi, you're a part of the National Public Health Institute team. So actually you work in the e-health support center. So you find yourself in the core of the e-health. So what I remembered when I met you for the first time is that you are actually in charge of approximately 10,000 phone calls or emails by Slovenian citizens who are calling your phone number or sending emails to your center. And you also need to provide support to those citizens who do not really use the computer yet. So I don't want really to press on the issue of digital literacy and digital inclusiveness, but what do you think? How can we ensure telemedical care for all citizens in the future, not only at the pilot phase level, not only as part of isolated projects or initiatives where one single doctor actually takes over 3/4 of their use of application. Well, thank you, Gregor, for the floor. How can we ensure telemedical treatment to all Slovenian patients? Perhaps I can here link up to what Vasya and Tomasz said. At the moment, telemedical solutions in Slovenia are really well developed or quite strong, but we still do not see them as such. I would like to mention particularly the e-prescription and e-appointment solutions, and we are of course very much familiar with those. But when it comes to e-appointments, I would particularly like to mention the e-consultation, which is a true telemedical service, making possible for family doctors or primary level doctors to consult with specialized doctors, but not in the presence of a patient. So the doctor can put a question to a specialist through the e-consultation solution, which is part of the e-appointment, and will receive a reply in the shortest possible time. E-appointment is available for many healthcare activities, and I don't want to list them because they are numerous. So I would like to invite all healthcare providers and professionals to really make use of this possibility, particularly today when we really hope that patients do not come to examinations or treatments in person unless really necessary. So e-consultation makes this possible, and it is also nicely integrated into local systems. In addition, I would like to highlight that it is extremely important to integrate national and local information services at the healthcare providers. This will improve the telemedical treatment of patients. We plan for further improvements. We intend to improve solutions for patients as well as for healthcare providers. And as you said yourself, those patients who wish to do so can really book an appointment for a treatment through our call center. They just need their referral note number and their medical card number, and our advisors in the help center will be able to book them for the desired medical service. You mentioned the figure of 10,000. Well, this can even vary. Sometimes it is even higher. It oscillates month to month, but we think that this is an extremely important solution for our patients. This is how medical services are much more accessible for our patients. Thank you very much, Heidi. And if I may, I would now like to pass the floor to Igor Zorko. You represent the Chamber of Commerce and Industry of Slovenia. Well, actually, you wear several hats, but in the Chamber of Chamber of Commerce and Industry, you of course are active in many industrial sectors, and of course, healthcare is one of the economic industries. But what would you say are the things that are specific to healthcare, and what is it that we would need to learn in terms of healthcare digitalization from your experience with digitalization in the public administration? Yes, thank you on behalf of the Chamber of Commerce and Industry of Slovenia and the Digital Coalition of Slovenia. I think that we all need to be aware that we are not living on our islands in digitalization times. I think that this was nicely put by the previous speaker. So it's not enough if only a patient is digitalized, or only a doctor is digitalized, or only a production worker is digitalized, or the user of a certain product is digitalized. Digitalization works as an ecosystem in which all of us are related and are using certain digital ecosystems or digital services. So we need to be aware that the technology is also pushing forward the changes in certain habits or processes, the tools that we are using, the work methods that we are using, which means that digitalization needs to be understood also in healthcare, and we need to make it understandable so that it is also useful. Not only that it is there, that it is available, but it is also, but in such a way that it is also useful. If you do not take ownership of something, if you don't take it as your own, if you don't understand it, if you don't have access to the internet or these solutions, well, then you can't reap any benefits. Together with the Ministry of Health and actors such as the National Public Health Institute, etc., the Chamber of Commerce and Industry set up an e-health working group which aims to promote digitalization in healthcare. And what we found was that there are certain negative obstacles. The first one being red tape. Let me just mention the GDPR and other issues that are really rigidly put in our regulatory framework, where Europe actually is not is pushing forward good solutions. And then the use of funds. We have certain funds available, but then uh, no programs actually exist that would push the development forward. We are just moving from one project to another rather than integrate them into a whole. And this is true in the public administration, in healthcare, and probably also in certain companies. So this is something that needs to be resolved through continuous funding and also continuous investments in our know-how and technology. Then there's the trust, which needs to be built over a long period of time, but it can be destroyed very quickly. Trust is built on knowledge, but of course, if we fail to educate, to inform, if we fail to leave people to have an open mind and think with their own minds, then we will run up against the problem. So we should really tap the potentials that and the programs that other public administration institutions or ministries have already implemented. Why shouldn't we learn from each other? For example, the Health Insurance Institute of Slovenia has promoted digitalization and solutions for many years. So we should all join hands and also incorporate smaller stakeholders in the background. So with joint efforts, we can really then set up a bigger ecosystem which can then be used in practices at home, etc. So let us link up, and strategies are now being developed. So the Digital Slovenia strategy is being developed, the strategy for the presidency of Slovenia. So let us put these things into our strategies and programs, and let us ensure a long-term or continuous funding for digitalization of systems. If my data is correct, the healthcare digitalization is funded only to the 30% of the funds available to the public administration. And we need to know that even the funds available to the public administration are not ample. So this is 10 times lower than what is available or in use in the business sector. So let us draft good strategies, let us intertwine, let us ensure the funds, and then let us turn to our users, the patients and the doctors, what they see would be beneficial to them, and then let us implement these solutions quickly in practice in such a way that are user-centric and really practicable, because the administrative solutions are not always appropriate. Yes, thank you. I can think of a metaphor which I heard of what can Slovenian healthcare be compared to. And this was actually a metaphor by Monty Python. So there was a football match between the ancient Greece footballers and the Aristotle, Socrates, and other colleagues meet Marx, Hegel, Kant, so the German philosophers from the 19th century, and the match begins. And instead of really passing over the ball, they started philosophing. So actually, they explored their individual philosophical avenues, which did not mean that they were poor philosophers, but they failed to find common ground. And I think, Igor, your figures actually were even lower than is true. We have approximately 30,000 employees in healthcare, and only 150 of them are IT professionals. And if you compare that with the state administration, there are 15,000 employees in the public administration and 750 IT professionals. Yes, your figures are correct, but still, even in the public sector, the number of IT professionals is far too low. It should be double that. Yes, I need to say that we have more than 150 IT professionals, which I just heard from the moderator. But how can we change this situation? How can we see e-health not only as e-health, but as an enabler, as a service which will facilitate the functioning of all other services? This should be in front of our minds. So, Tomasz, what can Slovenia pride itself on when it comes to healthcare? Because we are approaching Slovenia's presidency of the Council of EU, and it will be a part of the Council trio composed of Germany, Portugal, and Slovenia. So this is an opportunity for us at various levels, also at a political level, to really present what we've got. And healthcare is always topical. Germany, during its presidency, focused on health digital spaces, or spoke about these health digital spaces, which speaks about data exchange. What will Slovenia put on display when it comes to healthcare during its presidency? Well, thank you, Gregor, for this question. I don't know what it will present, but I know what it could present. My contacts tell me that actually there's not much thought yet on that, even though it's just 6 months to go. Well, the situation is even worse than you depict, Gregor. Not only that Germany spoke of that, actually this was its primary focus area, and the same is also repeated by Portugal. So we will find it difficult to avoid this subject matter. But what is really important is what these countries did internally, because they commit then in front of the international community to certain actions. So what I would expect is that Slovenia to take advantage of its presidency, and this of course then links up to the funds available in the European Union. What I'm missing is the strategy, and I said that I won't really dwell on this because this was mentioned several times already. So what can we pride ourselves on? Well, I think that many things are done well when it comes to technology and solutions. Of course, some of them could be more user-centric and user-friendly, but solutions themselves are not bad. What is true is that when introducing information system, and when using information system, it is well known that 50 to 70% of success depends on the rollout, how we train the users, how we install the system, how we adapt it to individual work processes. So the success depends more on that than on the software itself. So I think that this is a problematic area in Slovenia, particularly because of the fact that we do not really pay sufficient attention to this in Slovenia, and we do not really have people in healthcare institutions that would help us with such introduction. And the successful countries do have them. If I may present this more plastically, when we sell our system to a hospital in England, they will pay the same amount that they pay to us, to their internal resources who are then in charge of introducing and rolling out the system. This might sound weird, but I just mentioned that this actually factors in half of the success. So this is only right that it is done so. So I think that we can boast several applications, e-prescriptions, e-referrals, telestroke, etc., etc. This is not a problem. The problem is how we present these solutions. We should prepare ourselves for this. And we will fail to take advantage of this opportunity if we do not make the next step, and if we don't ensure that Europe helps us do this also financially. You know that eHealth Europe conferences uh, are held by the presiding countries, and I don't think that Slovenia intends to do it, even though this is a big opportunity which allows us to attract entire Europe, which will tell us what they're doing and how we can improve our situation. Tomasz, I apologize, but I need to really cut you off because we are pressed for time. But we also know that a biotechnology conference will follow at 4 o'clock, and I would like to take this opportunity to invite you all. You will find the link on the healthday.si. It will tell us how we can use stem cells in treatment. But my final question actually is directed to Vasya Repets, even though Igor raised his hand. So can we develop a more physician and user and patient friendly system? And can we do this? Heidi, can you agree that this needs to be done? Certainly, Gregor. Very quickly. So together with the users of IT solutions, with healthcare providers, with the patients and IT professionals, we are continuously working on improving the user experience. Here, several methods are coming to play for the certification and validation of these solutions. So this is, of course, a difficult and lengthy process, but a lot of emphasis is placed on that. I do apologize, Heidi, but I need to cut you off because of the time constraints. Igor, just 2 sentences, and then Vasya, the last question. Well, I would only like to mention that I do not really work in the healthcare system, but I would like to commend everyone who is working in the healthcare system, and we are seeing that we are really productive because most IT solutions are born in Slovenia, and if we have this knowledge, then we also have future. I think we can agree with that. Vasya Rebec, 5 years ago, I learned from Scots that there is a vision, every Scot to a physician through a telemedical link. Is this necessary in Slovenia? Does it make sense? And is it doable in Slovenia? And this is the only question that we can really put today. Vasya, well, I'm not sure. What I would prefer is really that everything we do is rational and embedded in the digital transformation area. Will every Slovenian have a telemedical link to a physician? I don't think that this is of primary importance. I think it's of primary importance that all Slovenes get the service they need as quickly as possible in the most user-friendly manner, whether it's through telemedicine or not. I think this is of secondary importance. Yes, the goal and the objective is the patient, to facilitate also the doctor's work, to reduce the workload of the doctors. But before we get there, we need to learn things. As we learned to use these devices, as we learned to use this, what we are using just now, well, this is in the spirit that I would like to complete this webinar with, and the entire series of webinars. And to conclude, Mojca, please take the floor. Well, Gregor, actually, you said it all. I trust that we will meet again at other digital transformation conferences or seminars that we intend to hold next year. I would like to thank all the panelists today, and I wish you all everything to stay healthy and to see you again soon. Bye-bye.